local election headquarters.
They both grew up on a farm, worked in the food business long before politics, occasionally show a fondness for flannel in TV ads, and now both have their eyes set on the same job.
To return to the United States Senate.
I'm Theresa Greenfield, and I'm running for U.S. Senate.
There is so much happening in our country right now. A virus that's killed thousands, financial struggle for millions, unrest in the streets, and a fight over a Supreme Court opening. Now, 2 days before Iowans can start voting, these two candidates make their case.
Iowans are interested in a change.
I am so excited to have you on board.
From your local election headquarters, this is the U.S. Senate Debate, Iowa.
Welcome. Thanks for joining us. I'm Dave Price. As we know, this will be the most expensive U.S. Senate race that Iowa has ever seen. And it may turn out that the winner of this race could help decide which party will be in power in the United States Senate beginning in 2021. We also know Iowans can begin the early voting process on Monday, so it's almost here. Now, as we come to you during this debate, there's so much going on nationally. We know the President of the United States, the First Lady, and nearly 24 United States senators and some of the staff and aides to the President have confirmed positive with COVID-19. That virus has already killed more than 200,000 Americans, and that includes more than 1,400 Iowans. So that's the backdrop as we begin our conversation. Let's introduce our two candidates. First, the incumbent in this race, the Republican Joni Ernst of Red Oak. Thanks for being here.
Thank you. Thanks so much, Dave.
And her Democratic challenger, the real estate executive, Theresa Greenfield of Des Moines.
Thanks, Dave.
Thanks for coming here as well. All right, just as a reminder to everybody, we really spread everything out here. There are about 9 feet or so between our candidates, so it probably feels a little distant here, but we're trying to be safe with everything going on. We don't have any timers, no buzzers, no gongs, none of that kind of stuff, but we are going to try to keep the conversation moving here so we can cover a lot of things. And please, we don't want a repeat of that presidential debate, so we're not going to do that stuff. We've had scores of questions coming in from viewers, so we're going to try to get to a lot of them. Just so everybody knows, both of you have said that you've had tests in the last 24 hours. You're both negative, so we want to get that out of the way.
Thank goodness.
Ms. Ernst, if we can start with you, why do you want another 6 years in office?
Well, thank you, Dave, and thanks to everyone that's watching this evening. I am Joni Ernst, and I was born and raised on my small family farm in southwest Iowa, where I learned the values of hard work, service, and faith. And because of that, I grew up wanting to serve my community, my state, and my nation. I have served as a local elected official. I've served as a combat company commander overseas during Operation Iraqi Freedom, and served as a senator. And I am fighting, of course, for our farmers because I grew up on a farm and my family is still engaged in farming. I'm fighting for our veterans because I know their struggles and I've had my boots in that sand. I'm fighting for working moms and working families because I've been through those struggles myself. And as a survivor of sexual assault, I am an advocate for those that have survived through very trying times that affect their lives forever. I will continue to fight for Iowans in the United States Senate. I am a fighter, folks. And I am ranked also as one of the most bipartisan senators in the United States Senate from either party over the last 25 years. Over 60% of my bills have been co-sponsored by my Democratic friends. So I want to thank everybody so much for allowing me to fight for you, represent your voice in the United States Senate, and I'm humbly asking for another 6 years.
And Ms. Greenfield, why do you want the job?
Well, thanks, Dave. But first, I do want to just take a moment. You know, it is a solemn time right now with our president in the hospital, with a number of senators, with Americans sick with this virus, and I want to offer them all my best wishes for a full and speedy, healthy recovery. Dave, I am a businesswoman, a small businesswoman. I'm a mother of 4, a military mom, and I'm a farm kid. And I grew up pretty dang scrappy, I gotta tell you, and I got in this fight for Iowans. You know, on the farm that I grew up on, my dad always said, there's no boy jobs, there's no girl jobs, there's just jobs that need to get done. And right now in Washington, we've got an awful lot of jobs that need to get done. You know, between the pandemic, between the derecho, between bankruptcy rates as an 8-year high, Iowans are struggling, and I know those struggles. You know, I grew up during the farm crisis. I watched families lose their farms. I went to auctions where the contents were put on a hay rack and auctioned off. And I put myself through college. I had to work many part-time jobs, and I was widowed at the age of 24 and had to start over, which I didn't do by myself. I had the help of Social Security and union benefits, my family, my friends, and my hometown. And I've run small businesses. I know how hard it is to keep the lights on through good times and bad times. And through it all, I'll tell you what, my grit, my resolve, it's always stayed rooted right here in rural America. And right now, we need leaders that are going to fight and put Iowa first. Senator Joni Ernst, she told us she was going to be independent, different, and make them squeal. But unfortunately, she's become part of the problem. She has joined party leadership. She votes with Mitch McConnell and party leaders 97% of the time. Iowans, they want that kind of divisiveness to end. And so I'm thrilled to be in this race. I'm here to introduce myself and, of course, ask for your support because I got in this fight for hardworking families and Iowa.
Okay, let's get into some of these questions and let's try to be as brief as we can as we go through this. Let's talk about testing first. I presume both of you had the rapid test, right?
That's correct.
Okay.
Yeah.
Looking at the system we have set up in Iowa, the governor has spent $26 million for this Test Iowa site. It can take days to get results or to go through your health care provider. Well, Ms. Greenfield, let's start with you. Would we be better served if we put this money toward rapid tests so people could get the quick results like you all got?
Well, Dave, to your point, Iowa ranks 47th in the nation in testing. We have got to do a better job, and I've been calling for a Phase 4 stimulus package and more investment in testing, in PPE, making sure, number one, we're putting the health and safety of Iowans first and foremost. After that, we've got to take care of our workers, and we need to make sure they have the help they need, expanding those unemployment benefits, more direct aid. And then finally, in this COVID crisis, we've got to make sure that we're focused on how we rebuild our economy. And Iowa, which is a state of small towns and small businesses, we got to focus on those small businesses and get some direct aid to our small towns.
Ms. Ernst, would we be better served if this were all set up as rapid test?
Well, I would defer to those public health officials. But yes, I think that is a great way to go. But once again, I would defer to them in understanding and knowing what are the most accurate tests. Certainly, we want them to be speedy, but we also need them to be accurate. The CARES package that I supported, as well as the previous packages in the United States Senate that supported those testing measures, also supported immunization development, therapeutics development. All of that is very important, and as we continue to push for the next package, we need to see those dollars going to that testing. Very, very important. My opponent, Theresa Greenfield, has opposed every package, both Democrat and Republican, that have come through Congress. She was very critical of the targeted relief package that we tried to promote in the United States Senate, which had those testing dollars in it. Democrats outright rejected that bill, decided doing nothing is okay. I continue to push for that. I was actually speaking with Susan Collins of Maine this morning, talking about what we need to do to ensure we're getting the testing dollars done, we're getting my child care package through, the second pass of the Paycheck Protection Program, which has allowed 61,000 Iowa businesses to remain in business, as well as bringing $5.1 billion to those small businesses in the state of Iowa. We've been successful. Those have been bipartisan packages. And again, I'm one of the most bipartisan senators in the United States Senate. So we need to continue pushing for that, and hopefully we see another package soon.
Do you want to respond?
Yeah, thank you, Dave. You know, I did support the CARES Act and would continue to support it this day, but unfortunately, since then, it has been months and months and months, and we need a Phase 4 stimulus package, and I've been calling on Senator Ernst to get that done and work and the divisiveness and get that kind of package done. The targeted plan she's talking about, well, that was a skinny package, and frankly, we got a big fat problem, and not even the President of the United States thought that that skinny package went far enough. And so, again, I've put out 2 plans on how we get back on our feet, and absolutely, we need to get a phase 4 plan completed.
Okay, let's move on. Let's bring in our next moderator here. Jim Needleman comes from our affiliate WHBF in the Quad Cities. Welcome.
Thank you, and it's an honor to be with you both. President Trump, as we know, declared the national emergency for COVID-19 in March, but since then left a lot of the management of the virus up to the states. When should the federal government's authority supersede the states when it comes to a national emergency to implement things like mandatory mask mandates, stay-at-home orders, and crowd restrictions? Ms. Ernst?
Yes, I think it is the federal government's responsibility to step in and provide those resources for the states and local jurisdictions. We have seen, of course, the testing across the state of Iowa. We've seen our small businesses supported because of the packages that I've been able to work on in the United States Senate. So certainly all of that is very important. That is the federal government's role. But remember that every state is very different, and some of the restrictions that might be really great in a crowded metropolitan area may not work for those that are working in agriculture in the state of Iowa. So it is important that our governors and our mayors, those that have authority, at the local level, can actually step in and determine what might be right for their citizens. But certainly federal government responsible for guidelines, they are responsible for resources, but I do prefer that those decisions be made on a case-by-case basis across the United States.
Ms. Greenfield, when should the federal government supersede the state's authority?
Well, when it comes to a global pandemic, the federal government should be the authority on how we get through this health and economic crisis. I've been frustrated, I know a lot of folks have, with the direction and the support from the federal government. We have to be supporting our public health experts. We have to be asking everyone to follow their guidelines across this country and in every state so that we as a community can stop the spread of this disease. And I'll tell you again, if we're going to get our arms around this contagion, we have to focus on health and public safety. We have to make sure we have adequate testing and PPE. I hear stories of nurses who still are wearing masks for 2 shifts. We aren't doing enough, and we have to do more to protect the public health of Americans.
We have a statewide poll that Red America, Blue America Research conducted, and it had asked people their bigger concern here. Would it be health or the economy? And even when you break this down by gender, in both cases, women and men both cited health as their bigger concern as they look at what's happening. Let's bring in our other moderator, Tim Seaman from KCAU in Sioux City. Welcome.
Thanks, Dave, and it's good to be with both of you as well. Just quickly here, I want to ask each of you about your satisfaction level with the president, beginning with you, Ms. Greenfield. 1 to 10, where do you rank the president?
Well, I'll let you pundits decide on the 1 to 10 for the president. But I'll tell you, when it comes to this pandemic, there's a lot of frustration, and we need stronger leadership. We need clear guidelines. We need the truth. We need to know what every individual, what our communities can do to contain this virus, because our public health is at stake. And when we aren't focused on our public health, it has turned into an economic crisis. I've crisscrossed the state of Iowa, and I'll tell you, I'm talking to so many small businesses, and their revenues are down. And why? Because they haven't been able to open, and we all want to get back to that, and it starts with focusing on our public health.
Ms. Ernst, can you give us a 1 to 10 rating on the president's performance?
Well, certainly, again, I'm not going to give the president a grade, but I would say, especially as we focus on the pandemic, which has really been very, very hard on Iowans and all Americans this year, is the fact that he did very early on put a travel ban, a travel restriction on those that were coming in from those hotspot areas. And I'll remind everyone that Democrats criticized the president quite heavily, especially Vice President President Joe Biden, because the president was putting his foot down and saying, no travel in, we want to make sure that people are screened and that they're quarantined. So I think he was doing the appropriate thing. As we are looking at the economy at large, certainly for states like Iowa, again, being very agriculturally based, we have essential workers that have to be out there, whether it's farming and animal agriculture, and working to provide food and fuel for the rest of the United States. So I think, again, going back to a case-by-case basis across the country is very good, and that's why I'm so pleased that we have a wonderful governor in Kim Reynolds that has been able to work with the administration, work with others, and collaborate, and that's exactly what we have been able to do in the United States Senate, with Democrats and Republicans coming together to talk through solutions and what we would recommend for moving forward. And that's exactly what we have done. We've been successful with the packages that we have moved before, and we continue to work on the next relief package.
All right.
It is very important that we do that.
Thank you.
Okay, we want to share some more results from our statewide poll here. This one was about, do you trust your doctor to accurately report the results of COVID-19 and your situation? And you can see the breakdown when it goes by party here, Democrat, Republican, Independent. Overall, it works out to be about 3/4 of Iowans said that they do indeed trust their doctor when it comes to this. Ms. Ernst, can you clarify, you were talking to a crowd in Waterloo where you expressed some skepticism about what the reported numbers are when it comes to COVID-19. You later put out a statement where you cited that 180,000 people at the time had died. Are you still skeptical that they are overinflating the numbers here?
And this was in response to a question that came from one of those audience members.
Right.
I do a 99-county tour every year. I'm out meeting with Iowans all across the state. And so it was really important to go ahead and respond to that. And it was the culmination of a number of conversations that we have had. You alluded to it earlier, Dave, and that with some of the Test Iowa results, whether we were getting false positives, false negatives, it's a matter of reporting. And again, going back to the fact that we need to continually provide investment for testing, additional accuracy. But
so
I
you're
do
not
trust
doubting that 200,000 people have died?
No, not at all.
Okay.
No, not at all. But certainly we want to make sure that testing is accurate, it's being reported accurately, and I do use the CDC numbers.
Okay, let's talk
Well, actually, Dave, I just want to jump in here because Senator Ernst really can't be trusted on health care. And definitely here in Iowa, not only has she voted multiple times to end the Affordable Care Act and our protections for pre-existing conditions, but she did push a conspiracy theory that suggested our doctors and our nurses, they're liars and cheats. And that's just inappropriate and wrong. And Senator Ernst, you know, if you don't believe in our doctors and nurses, why should they believe in you?
May I respond first? Thank you. Absolutely. I believe in our doctors and nurses. Matter of fact, I have a member of my family that's engaged in the healthcare community. She is wonderful. She has responded to a number of COVID cases. And so they are fighting every single day, those essential workers that are out there, making sure that our communities are safe. So again, I was going back to a conversation and questions coming from a face-to-face audience. And again, I'm out across the state, 99 county tours. Every voice in Iowa is important to me. My opponent, Ms. Greenfield, has only been to about half of Iowa's counties in the 16 months that she has been engaged in this race, which tells me that of those counties you haven't visited, their voices aren't important.
Dave and Iowans, I have done over 250 campaign events around the state.
Zoom events.
The favorite thing that I love to do is to meet Iowans. But we also have been following the public health guidelines of this pandemic and making sure that not only are we healthy and safe, but that we're keeping the communities healthy and safe. And so we've been meeting in person and we've been meeting virtually, and we have been listening to Iowans from all 99 counties, and we'll continue to do that because Iowans know that if you listen, you can learn, and you can lead best as a United States Senator.
Okay, you both brought up health care. Jim has a question specifically about the Affordable Care Act in the future there, Jim.
Yeah, this is the first of our rapid fire questions. Actually, we're going to talk about health care policies. We want to stick with yes or no answers only, please. So do you think insurance companies should be allowed to limit lifetime benefits? Ms. Greenfield, you first, yes or no?
No.
No.
Should insurance companies be allowed to drop policyholders when they get sick? Ms. Ernst?
No.
No.
Last one, should insurance companies be required to spend 80 to 85% of the premiums they collect from policyholders on the health care costs of their policyholders and claims? Ms. Greenfield?
Yes, and more.
Ms. Ernst?
Yes, I would agree.
Well, you both agree with those provisions that are in place in the current Affordable Care Act.
Can you both, Ms. Greenfield, what's a suggestion that you would have to improve? You don't want the ACA overturned here and eliminated, so what would you do to strengthen it?
Well, I wouldn't do what Senator Ernst has done, which is she has voted repeatedly to end the Affordable Care Act, to gut your protections for pre-existing conditions, to end Medicaid expansion, which has been a lifeline to our rural hospitals. And I'll tell you what, I have a lot of family and friends who already drive 20 minutes or more to get groceries, to get to their churches and their faith communities, and to get that rural health care. We have got to make sure that we don't overturn the Affordable Care Act. For me, healthcare's a right. It's a privilege, and we need to make sure everyone has access to high-quality, affordable health care. Dave, I would want to strengthen and enhance the Affordable Care Act, add a public option in, and of course make sure that Medicare is negotiating to bring down those prescription drug costs, putting a few bucks in our seniors' pockets and saving us as taxpayers $500 billion.
But not Medicare for all, right?
I'm not a Medicare for all
Okay,
supporter.
Ms. Ernst, when the Republicans had the majority and you were looking to get rid of the ACA, there was no alternative in place. So wouldn't it be technically correct to say that that is not protecting pre-existing conditions since there wasn't anything there?
No, Dave, and thank you very much. This is really important, and you bring up pre-existing conditions, because as much as the Democrats want to make this into a fight about pre-existing conditions, I have heard of no one in the United States Senate that has said that they shouldn't be covered. Now, I grew up with both a sister and a brother that are type 1 diabetics, and my mother gave them insulin shots twice a day. And so I know how important it is to cover those with pre-existing conditions. Now, in a response to Jim's question as well, I actually do support having the federal government provide that backstop for those insurance companies, for those that have pre-existing conditions, those that have complex medical conditions, where maybe their expenses are more than an average citizen or patient. But what we see is a move towards a government takeover of health care. And while Ms. Theresa Greenfield may deny that she supports Medicare for all of her big liberal backers do support a government takeover of health care. They would like to insert a bureaucrat between the doctor and the patient. We know if that happens, the wait times could increase, the quality of health care could go down, and Iowans will be footing an even larger tax bill. What the Affordable Care Act did not do was stop those premiums from going up. So now we have Iowans that struggle to pay their premiums and their out-of-pocket costs, the quality of care, they're waiting longer. So we know that we don't want a government takeover of care. We need affordable care, and we need to do it soon.
All right, so if you have some donors or supporters who are backing you who believe in that, does that mean you do?
Dave, I got to tell you, every time with Senator Ernst, it's Republicans against Democrats and Democrats against Republicans. I've never seen such a mess in Washington, D.C., and I raised 3 kids. I'll tell you what, Senator Ernst, she voted to end the Affordable Care Act. She voted for a tax bill that now has put the Affordable Care Act in front of the Supreme Court. Health care is on the ballot, and in November, the Supreme Court will hear that case. And it is really important that we protect our health care. It's not just pre-existing conditions. It's coverage for maternity care. It's coverage for mental health. It's our rural hospitals. It is limiting that donut hole that our seniors depend on those dollars. And so I'll always be fighting for high-quality, affordable health care for all of us.
If I can respond as well. Thank you. And yes, so the plan, the medical plan that they want us to move towards with a government takeover of health care, it would be a Medicare for all situation. Our seniors have paid into Medicare their entire lifetimes. And what we would do is dilute their opportunity for Medicare by expanding it to those that have not paid into that system. What it would also do is bankrupt at least 52 of our Iowa rural healthcare systems. Now, I am part of a rural healthcare system. I live about 6 miles from the farm that I was raised on. I am part of that rural America network, and I understand what a government takeover of healthcare would do to the folks
Dave,
like
a
me
public
and my
option
family
is something that's
that
going to
live
make
in
sure
rural
every
areas.
Iowan gets the care they need. And what a public option will do, in addition to expanding and strengthening the Affordable Care Act, is it will create competition. And as a small businesswoman, I understand that kind of competition. That will drive down costs and make sure that we can get care for all Iowans.
Okay, one thing about health care that we've seen is it's kind of exposed this weakness we have in our state about access to broadband. A couple of stats here. If you look at the access that people have and the necessary speeds here, you know, 25 megabits per second here. That's kind of the threshold here. So we have more than 300,000 who don't have that, and we have 100,000 people who don't have internet access at all. Tim's going to pick up from there.
We've seen during this pandemic the importance of telehealth. It's connected our rural hospitals with our major population areas where the doctors are at to help those rural people. So moving forward, how do you protect Iowa's broadband? How do you grow the broadband to protect our rural hospitals, especially during these times? Ms. Greenfield?
Yeah, Tim, first off, I want to say I really was delighted to see this administration expand telehealth during this pandemic, and I'm going to be working hard as the next senator to make sure that's permanent and that we continue to grow telehealth. And one of the things I certainly have thrown a few elbows to both parties on, Republicans and Democrats, is the lack of a robust infrastructure plan. We're 50th in the nation in bridges in this state. They're not Republican bridges. They're not Democratic bridges. The bridges need to be fixed. And to your point, we need to invest in broadband, not only for our children who may be studying from home right now, but for our farmers who can't access precision farming, for our entrepreneurs who want to compete in the global marketplace. And so a robust infrastructure plan is something that I'll be fighting for Iowans.
Ms. Ernst?
Absolutely. Thanks so much, Tim. This is something that I actually have been actively engaged on in the United States Senate. One of the many measures that I have been supporting across the aisle and working with Democratic colleagues on infrastructure and broadband is something that we all agree on very much. So I have been part of an effort to roll back regulations that actually harm some of our smaller providers in the state of Iowa. A number of our rural co-ops, they do provide a number of opportunities for broadband. And so what we want to do is make sure that they are not held to the same standard as a large telecom company like Mediacom or others. They have the ability then to reinvest those dollars they save from not going through the same level of regulation as those larger providers, and they can roll that back into their infrastructure. We're also working on remapping efforts across the United States, making sure that the rural areas are properly mapped so we know what families are receiving those broadband services and what families are not. You know, I know how difficult this is in the rural area. Again, I still reside in Montgomery County. We want to make sure that we're able to reach out, provide those services, even if you are in a far corner of this state. When it comes to infrastructure, we think it's really important as well. Again, I was part of bipartisan efforts in the Public Works Committee, passing out a very big infrastructure bill that would address those roads and bridges. And folks, you know what? It came out of that committee 21-0.
All right, thank you.
Bipartisan.
Thank you.
You know,
thank you
Senator
both.
Ernst, you've had 6 years. You've had 6 years, and we're still 50th in the nation in bridge suitability. 300,000 numbers that you had on the screen, folks that don't have access to the internet, and it's not just there. We've got locks and dams that need to be fixed. I've had the opportunity as part of this campaign, the honor, to talk to mayors all over this state. And the number one thing they're asking for is help with infrastructure, wastewater treatment system, sanitary treatment system. Republicans and Democrats, they didn't get that job done. I'm going to get it done as your next senator.
I would love to respond. She
super
interrupted.
fast, please.
So, yes, so I am so thankful that Ms. Greenfield supports my efforts because, again, that infrastructure package came out 21-0, bipartisan. The Water Resource Development Act, I was also part of that measure, came out wildly bipartisan, as well as the locks and dams. I actually was the co-sponsor of the amendment to our infrastructure package with Senator Tammy Duckworth of Illinois. Bipartisan.
All right, thank you both. We should have made this hour-long debate 2 hours here, but we need to take our one and only break here. When we come back, we're going to talk about unity, education, term limits, and hopefully a bunch of other stuff, too. Stay with us as our hour-long U.S. Senate debate continues.